This is going to be only one of 2 milk banks in the entire state of Michigan. And hot off the press, you are the first to know that we delivered our first batch to our hospital at noon today. So we are up and running. It was in 2019 when, under Wendy Kim's leadership, Wendy, wave your hand, she's our chief nursing officer, she had a team come to her from Women and Children's, and they had an action plan of all the things they wanted to do, and the very bottom of the action plan, it said dream. And she said, and she challenged them and saying, what is this dream that you have? And the passion that the team came up with of, we really would like one day to have a milk bank. And Wendy said, why does it have to be one day? What do we need to do this? And that started a whole whirlwind of activities that got us here today.
You know, this is going to provide incredibly safe, pasteurized human donor milk for infants who require it. And we're dedicated to the ongoing growth and enhancement of the milk bank, guided by our mission to provide the best care for all of our patients and to really improve the health status of all the communities that we serve. This is a piece of that puzzle and an important piece. Together, we'll continue to explore opportunities to expand and optimize this unique service for the benefit of all. And it's fortuitous that it starts today with an actual donation being made at the hospital. But where we can take this and expand this is really not a dream. It's just about an execution. And we've got such a great team to make sure that we execute flawlessly. I do want to just mention, and Emily talked about the FDA, but the entire Henry Ford Health Women and Children's service line, as well as Human Resources, there was a whole group of people that worked together to make sure that this was going to be approved and approved in the highest standards of the FDA. And part of that was also bringing mothers and donors, prospective donors, into the process, into the planning. Health is a team sport. In fact, life is a team sport, and Henry Ford is definitely all about the team. And that team includes patients, community members, and everyone else. And to see that they were all such an integral part of this just really warms my heart. I mean, it's what we get up for every single day. So again, just congratulations to this entire team. I like to say that this is a big deal for our smallest citizens.
But when I think of over the years working with the community in Jackson, with the community health center, with the expansion of behavioral health clinics and the commitment to the community, to mental health services and so on, and to see over and over again when there's a need around healthcare, this community steps up. And it's been wonderful to have an opportunity to be your partner in so many ways, because I know you care, you're committed, you want to make a difference. It's already been said, but I have to say it again. There's nothing more important in the world than making sure our youngest citizens get a healthy start. And that's what you're doing. We understand that breast milk is liquid gold. And that it's critically important that every child have the opportunity to be able to get that healthy start. It is nature's perfect food.
2, 3.
Georgia Fatasic, the retired president and CEO of Henry Ford Health here in Jackson. A project celebrated today, but actually started under your administration.
It did. I remember the proposal they talked about with this group of nurses having a dream bag and the milk bank. And, you know, Bart, it's true to having a community-based board. What have our board members said? We always find a way, Georgia, to serve the community. And here we are, Bart. It took a while because it's a big project. But it's here, it's open, it's going to serve the babies of this region.
Well, and it wasn't just 5 years ago or so. As a nurse, as a practicing nurse, that's always been a big part of your clinician time.
Well, it has been. So when the nurses would come to me and physicians to present clinical proposals, we could speak shorthand. I appreciate having that background, and my heart, rests with that clinical support, what we need to do to serve our patients.
Well, I know it was a very stressful, trying time as you sought answers for the future of Allegiance. You must be happy with how everything has gone, everything has turned out, and as you look around the campus, the growth and improvements of the health system.
I am so grateful, Bart, that what we started in taking a small community hospital foot to where it was had the culture, the grounding, and the people, the staff, the physicians, and the community support that have made it seamless in many ways to just continue. As a leader, and Senator Stabenow and I were talking about this too, you have to plant the seed then for the next generation, and that's what makes me so proud, because this is my community too.
Well, thanks for being here today.
Thank you, Bart, for being here as well.
Great.
I'm honored to be here representing the team whose passion for caring for women and babies has helped make the Henry Ford Milk Bank Jackson possible. Every day they live up to the standard that earned Henry Ford Hospital the prestigious baby-friendly designation, and only 14 hospitals in Michigan can claim this distinction. This recognizes our commitment to encouraging breastfeeding and caring for mothers according to the guidelines established by the World Health Organization and the United Nations Children's Fund. Henry Ford Jackson Milk Bank is an extension of that commitment, and it enhances our ability to promote breastfeeding and all of its benefits.
I'm thrilled that we now have this unique ability to provide a priceless resource for our youngest patients. We know that breast milk gives babies the best possible start in life and that it can't be duplicated in a lab or made in a factory. We also understand that for many unique and personal reasons, it's not for everyone. But in cases where families want to provide breast milk for their babies but can't, donor milk can be life-changing. By having a milk bank in our community, we increase our ability to offer the life-saving advantages of breast milk to families. The benefits of breast milk feeding are well established by decades of research. The safe, pasteurized donor milk these babies will receive from Henry Ford Milk Bank Jackson can make a major difference in the short and long-term health of babies.
Fast forward a few years, I'm now married with 2 kids. Although I no longer work for Henry Ford, I have had the privilege of being one of the first donors. When I was asked to share why I donate to the milk bank, the answer came easily. First, I'm raising my family alongside my closest friends, who love and support each other. I know how important it is for women to help women, encourage each other, especially in our most vulnerable stages of life. Donating my extra milk helps extend that support to families outside my circle.
This is a very important mission
Yes.
for the
Really is.
Senate.
There's no question. I'm so excited that I've been able to partner and be able to bring in federal funds for what is very significant for new babies, low birth weight babies, babies getting started in life, where we know breast milk is the best kind of milk, and sometimes that's just not possible for a mom to do, and so we want to make sure that there's other ways to get breast milk, and they have so many wonderful women willing to donate if they have excess milk and can bring it to the milk bank and then have it available both for those in the hospital. They're going to start with new moms, in the hospital and babies in the hospital, and then moving out broadly the community. But it's really about giving babies and supporting moms to give babies the very best, healthiest start in life. And I can't think of anything more important.
Well, it's very timely in that we had the shortage of
Yes.
baby formula
Yes.
just last year.
Yes, no question. I mean, there was a number of reasons for that. Unfortunately, starting with a plant and some issues around that had to close a huge plant in southern Michigan, and then unfortunately rippled across the country. We have done a number of things to fix that, and I've been very involved in efforts to make sure that formula is available and there are more options and so on. And formula is important, but what is happening here is really what we call liquid gold. It is the best way for a baby to get a healthy start is breast milk, and it's wonderful that women are willing to come forward and be a part of volunteering to make that happen.
Well, I know mental health is a big issue for you, and it really does. It has an impact. Availability, nutrition, food security, all impacting mental health.
All of that. And in fact, I mean, a new mom who is excited to be a mom and to have her baby and wants the very best for them, and then if something is happening where she's not able to breastfeed or there's some other issues, it's a huge pressure and impact on women who are worried about their babies. And in addition, of course, when the formula crisis happened, I mean, it was just horror. But what we're doing here is both giving moms peace of mind as well as children a healthy start.
Well, on another quick note, it's budget season, and I know that's a big focus for you this summer. How are things looking?
Right. Well, we avoided a default by coming together in an agreement, and I would argue that it didn't need to be a crisis, but we at least got it resolved, and now we're moving forward on the regular budget process. For me, as chair of the Agriculture, Nutrition, and Forestry Committee, it's also the time that we are writing a new 5-year farm bill, so it's very important. Unfortunately, we were impacted in that debt agreement with some dollars that are no longer available for us to write the farm bill that I'd hoped with. So it's going to make it a little more challenging. We will get it done, but our farmers deserve the support. They're in the riskiest business in the world, and nobody else has to check the weather every day like the farmers do. And we have a farm safety net, a family safety net, and the largest investment in land and water conservation that we make as a country comes through this thing we dub the Farm Bill. And so there's a lot of pieces to it, including supporting small towns, rural communities, like where I grew up and like where most of Michigan is. We want to make sure that there's a high quality of life and that people can live and be successful in small towns.
Bob Riney, President and CEO of Henry Ford Health in Jackson, for this grand opening and ribbon cutting, and one of only 2 milk banks in the state, and the first and only for Henry Ford. Why did you choose Jackson for this?
You know, we chose Jackson because in many ways the passion for this project was here in the leadership, and the challenges of infant mortality and low birth weight babies is really real, and we really pride ourselves on being very focused on what communities need, and this community can really be an example, a role model for how we reverse that, unfortunate statistic. So it was an easy choice.
And really, you think about the population that you serve in the city of Detroit, with maternal and infant health, also a problem there. So it's really a statewide problem.
It's absolutely a statewide problem, and it particularly affects disproportionately minority populations, and there's a way to fix that, and this is one of the ways to fix that. And we oftentimes think about really big, massive solutions, and sometimes the solutions are small, logical things like, let's make breast milk available for people that either are having trouble producing or for babies that don't have access to breast milk. And so we've struggled in this state for a long time on infant mortality rates. I'm really excited about this because I don't think this is the answer, but it's a big part of the answer.
Well, we heard Mrs. Gant say that she started working on this project 5 years ago, and Senator Stabenow said it's going to be many years before we as a community realize the benefits of this. It's a long-term project, but a long-term investment for the system.
That's the value of really being focused on community health, because if you're focused on community health, you have to take a long-term view. You're not going to get this in 1-year increments. You have to commit to really being part of the health status of a community, and Henry Ford, that's our number one mission. I mean, that's who we are. And so for Jackson, this is not something that we're going to celebrate major changes in statistics in a year, but we are going to look at generational changes that make a difference and make Jackson a thriving, sustainable community, and nothing's better than that.
I overheard you tell Senator Stabenow that her being here sends an important message to the community, and I think you being here as often as you are does as well. This market, Central Market in Jackson, is a pretty big part of Henry Ford Health.
You know, it absolutely is, and it's not just big in terms of new territory, new geography, but it's amazing how many best practices are born in this market out of this hospital and then translated to the rest of the system. So while some of the best practices from Henry Ford Hospital and other places get transferred here, it's a two-way traffic, because a lot of solutions come from small teams just dreaming, as our speaker said, and then going to work on execution. And so we get so much out of this partnership and relationship that we're just thrilled.
Emily Moorhead, president of Henry Ford Jackson Hospital. Program now kicking off today. What incredible luck with timing that you were able to make the first donation from the milk bank just an hour ago.
That's correct. That's correct. So we are officially open. Not only was it the ribbon cutting, but today was the first day of full production where we were able to deliver our first batch to our Women and Children's unit at the hospital. So just a wonderful achievement.
Yeah. And it was interesting to hear both Senator Stabenow and Bob Riney talk about the importance of Jackson, both in the healthcare in general, but for the health system in particular.
Oh, absolutely, absolutely. This is we're only one of 2 donor milk banks in the entire state of Michigan. So when you really think that we're going to start here and be able to spread it to not only other hospitals, but throughout the community, we're just really excited about that.
The impact of maternal and infant health might not be realized for years, but the reality is the contribution of nutrition or lack of nutrition to a child's survival is it's pretty critical.
Oh, it is. And the first couple days of life are the most critical. So even being able to just bridge the gap until women's milk comes in, or if there's a sickness with the mother or the baby, and being able to supplement with that is absolutely critical, and actually has downstream impacts on the health of the child into adulthood.
And I think the infant formula shortage last year educated a lot of people as to the importance of availability.
Oh, absolutely. And there's nothing better. As Senator Stabenow said during her remarks, it is truly, breast milk is truly the best food for an infant with the most nutrition. And at the donor milk bank, you're not just getting one donor. They have a very robust process to make sure that it's at the highest nutritional rate that can be provided.
I remember when I was here a couple of months ago, there was concern that it would be difficult in attracting volunteers, but it sounds like you've had overwhelming support.
You know what? It is incredible, and I just want to do a selfish plug. If you are a mother breastfeeding and you have extra milk, please call us. Please reach out. We are looking for more and more donors, but it's really the word of mouth. We talk to our patients when they are delivering to let them know that we do have this new service, but it's the word of mouth of the community that's really going to get it out there, and the more donations we have, the more people we can serve.